WMEL.
That's the sound of the 1951 Ford Victoria Hot Rod, fully restored and donated from the private collection of A.J. Hires. It's the 2017 Win the Classic Ford Car Raffle to support Helping Seniors of Brevard. You have to see this car. I'm Kerry Fink, and I'm inviting you to visit helpingseniors.brevard.org for full information on this exciting car raffle. That's helpingseniors.brevard.org. Stay tuned for more info on the Talk to Me radio network. We're glad that WMEL cares about the space and Treasure Coast.
The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
This is Joe Steckler, folks, your host for Helping Seniors, the radio arm of helpingseniors.brevard.org. That's our website, helpingseniors.brevard.org. Check it out. Go on it. See what we do. Look at the radio shows. Look at the TV shows. Look at my newspaper columns. Everything's archived. All we do is archived. We reach out across the United States, and believe me, this is the honest-to-goodness truth. We get calls for help here in Brevard County, 4 people in Brevard County from all over the U.S. That's true. In fact, I get a lot of them sitting in my chair at home on a Saturday night. I've gotten calls. We've gotten calls for the home equity line of credit lady we had a call from California because they saw her on the YouTube thing and thought she explained it better than anybody had ever heard explain these things out in California. So he wanted her to work with him in order to get a home equity line of credit from California. So it's a small world made even smaller by the advent of technology, but there's still no substitute for the one-on-one, person-to-person contact in the business of elder care. That's extremely important to remember that. So the purpose of Helping Seniors is to inform, educate, advocate, and then connect seniors and those that care for seniors to the many wonderful resources we have here in Brevard County. We have many, many sponsors that help us, and I'll mention just a few of them before the second part of the show. The Ines Institute, Dr. Lee Sheldon, Bill Johnson, elder law attorney at this radio station, Wusthof, Zon Beachside, and the director there, Greg Kennedy, is one of our panelists today. And the other panelist today is Carol Knouse from Avid Home Care, and they're a new sponsor. Yes. So what we're going to do today is show how assisted living care and home care work together to provide part of the larger network of services for seniors. And one of our goals, folks, Helping Seniors goals for this year is to build a radio network. And I envision the network of being something like a 2-hour daily show, 5 days a week, longer if necessary. But what we need to do is build the sponsors so that the radio station has the revenue to cover their costs, and we have to cover some of the operational costs. And it's a business. It's a business of helping people. But if we do a better job of providing information, I'm confident that more of the older people and the people that care for the older people will tune in and listen to a show they know gives good information on how to receive senior care. And the reason I said this is because a couple weeks ago I spoke at Holy Name Church to sell raffle tickets for the car, and I told just a couple things we do. Had a call at home this morning from a lady that was concerned. She had a hip operation or was going to have a hip operation, and then she was concerned about her Medicare, Medicaid, and all these costs. I said, you need to talk to somebody from Shine. And she said, what's Shine? Serving the health insurance needs of elders. That's what it is, folks. And this has been around for a long time, but it's just a good classic example of why we need to get out there and get more information. People need to know more about these organizations. So I'll start with Carol first. And since you're our new person, what is Avid and what kind of services do you do, Carol?
Sure. Avid is a home care agency, and we provide a variety of services classified as personal care, And personal care services include things like dressing and bathing, grooming, toileting assistance, transfers between bed and wheelchairs and things of that nature. We provide companion care. Companion care is classified as non-hands-on care, and that would include things like transportation, light housekeeping, meal preparation, just assistance around the home. And then the third category of care that we provide is something I think that is really of interest to families, and it's called respite care. And respite care is either personal or companion care, or both, that we provide to a loved one for someone who is typically a normal caregiver for that loved one. So, for instance, a son or a daughter that typically cares for their loved one, they need to go on vacation. They need some time for themselves. They need to step away a little bit. And so we step in and provide that care for them while they're away.
It's interesting that you just cited those three types of care, because most of our listeners wouldn't know that what was the act that Johnson did in '65? The Older American Act. Mm-hmm. Under the Older American Act, when we created Medicaid and did some other things. But between those programs and some of the state-assisted programs like the Alzheimer's Disease Initiative, and then all the federal money that is awarded to Aging Matters here in Brevard County, these organizations get hundreds of thousands. I'm absolutely the truth. Hundreds of thousands of dollars to provide exactly what Carol is talking about and what Greg will talk about in just a minute. But if you don't know that those dollars are available, you don't know to access them. So that's one of the reasons I believe we need to do a better radio network here in Brevard County, so that people will know more about these programs. What is your background, Carol, for making this kind of care?
Well, my business partner, Betty Beresford, who was not able to be here today, Betty and I own the agency together, and we happen to be sisters. Betty,
yeah, our sisters.
Yeah.
I didn't know if you were going to say that or not.
Yeah.
She's not here, so and I want to say that.
Yeah. And she has a background in the healthcare field. She's an RN.
Right.
And so, having been in that field for so many years and retired, her husband had physical therapy practices up in New Jersey, and she's been retired for a little while. And we talked about doing something together. My background is business, so I run the business office and manage the technology and billing and all of the client scheduling and all of those kinds of things. And so we have a really, really good match, because she deals with the client side and, the more medically related things, even though we're non-medical, and I deal with the business.
Okay. Avid Home Care, do you have RNs that work for you?
We do. We have in the state of Florida, the home health care agencies. We have to have an RN on staff to supervise our caregivers, and our caregivers are typically certified nursing assistants, CNAs, home health aides. And we do have companion aides that aren't certified, but they have to have training in CPR and those kinds of things. The RN is the one that actually comes out first to visit a client and goes through an assessment process and develops a plan of care for the client. And then, depending upon what is called for in that plan of care, if there's personal care, meaning hands-on care, with showering, grooming, those kinds of things, then we assign a certified person, so either a CNA or a home health aide. If it's something just like transportation or maybe some light housekeeping, we may assign a companion. So, but the RN is the one that goes out and does that assessment.
Okay, now, what was be a ballpark? Do you assign your services in a block of 2 hours, or a minimum of 2 hours, or do you have a minimum?
No, we don't. We don't, Joe. We actually we're one of the only agencies in the area that really are. we have really no hourly service minimums. Now, we typically won't go out for less than an hour because most people, whatever it is they need, we're probably going to be there for about an hour. But we don't have any 3 or 4 hour service minimums. We will come out and do things like come out for a shower to help people. And as a result of no minimums, it's a very affordable for people to have those kinds of services. And we'll even do split things. So we have clients, for instance, that we help get up in the morning, get them a little breakfast, maybe a shower, and then we're gone. And then we come back in the evening for an hour or so, help them get ready for bed and that sort of thing.
So you do it, you're charged by the hour?
We do. We charge by the hour. Uh-huh.
Would you mind saying what you charge?
No, not at all. We have a very, very simplified rate structure. For companion services, which is the non-hands-on services that we talked about, housekeeping, transportation, they run $18 an hour. For personal care services, things like bathing, grooming, and that kind of assistance, they are $20. And then our top category would be for a client who is non-ambulatory, perhaps bedridden, where they need a tremendous amount of service, and that would be at $22 an hour.
That's very good, isn't it, Greg?
Yeah, it's very competitive.
Yeah, it really is.
And we don't, once beyond an hour, we just bill in increments of 15 minutes. So if we're there for an hour and 15 minutes and it's, somebody that needs personal care, it would just be $25. So we don't bill by the hour. So.
Wow. The reason I'm asking all these questions, folks, is because I have knowledge of a family in California that has a person in the family that is on a ventilator and as a result of a car accident, and they brought him home. Brought him home on a ventilator. And the only way they could do that was they would have nurses around the clock.
Right.
And a little known factor is the Philippines provide a huge number of nurses here in the United States. And these nursing interns are only charging this family $20 an hour to be there. And they have $20 an hour for two people $20 per person for two around the clock. And just their nursing costs alone are something like $15,000 a month. Just the nursing costs. So the questions I'm going to ask Carol and Greg, and I'm going to get to Greg here in just a second, are all designed and developed today to show you how home care and assisted living care work together in forming care elements and what I call elements of care as we work up a ladder. Greg doesn't need the people that Carol can care for. And Greg's organization does such a good job that you don't need to compete for people like that. You are caring for the people that need the elements of care that Carol cannot provide, right?
Absolutely.
So let's go in and talk about Zon for a minute. And if there's something, you were very nice. You didn't interrupt. You didn't ask a question or anything. You just sat there very nicely. And but Zon is a very, very good place. And folks, I'll talk to Greg at the break if I can mention something that they're doing, but I don't want to do it without asking his permission first. But I've been very, very impressed, Greg, with the type of care that Zon has been providing here in Brevard County since you opened. How long have you been open now?
We opened in July of 2016, so we just passed the year mark this past July.
In 1 year, you've managed to completely fill your organization and have a waiting list of roughly 20-some people.
We did. Very exciting.
Doesn't that give you a sense of accomplishment?
Absolutely. It really validates our vision from day one, years back, when we really started planning for Zon, was really trying to reinvent the resident experience. And so it definitely validates the vision for that.
Would you tell our listeners, in comparing Zon to other types of assisted living we have in Brevard County, what the average rate of occupancy is, and with yours, in fact, being at 100%, why you're so high on what you're able to do at Zon? Because it's important. It's what people need to know about. Because these are the types of questions they need to ask when they're going to go look for someplace. And I want you to talk about that too.
Absolutely. I mean, it's multifold, and we could have an hour conversation about what families should look for. But I think it's important for families to really ask the important questions and decide, for my loved one, what's important in their life. And so that's really what we did when we built the vision for Zon, was looking at the dining experience, looking at the healthcare experience, the living experience, all of those things were very thought out because we wanted to kind of improve upon what you would define as maybe the typical assisted living experience. And we felt, with the baby boomers and, everything you hear every day about the aging population, we wanted to hopefully be ahead of that and try to kind of reinvent that experience for the residents.
Well, you still haven't mentioned what I want you to mention, and I'm going to make you say it. You're at 100%. How does that rate to the average percent occupancy throughout the county?
I believe the occupancy is right in the mid-80s, 80%, so around 85%.
And folks, I tell you, I've been in the care business, go all the way back in my Navy career too, and I took care of 550 people in a nursing home / a hospital / assisted living / well care, total of 550 people. So I've seen it all, and I had 3 doctors and 33 nurses that worked for me. So I understand what it is, and with a 52-bed hospital. So you've accomplished a lot at Zon. Not only do you provide good things there, you do a lot to help the community understand what you do at Zon. I know that we have filmed some of our television shows, folks, at Zon, because we want people to see what the inside of some of these facilities look like, and we try to do that with all of our sponsors that have a healthcare organization type things. We'd like to go there and film shows so that people get an understanding of why we've selected some of these people and ask them to be sponsors, because it is important. We have probably four or five assisted living facilities now that are sponsors, and every one of them are good places, and they each provide the type of care that enables a family to do real planning. Perhaps you could tell our listeners just a couple of the things that make Zon a little bit different from other assisted living facilities. In particular, I would like for you to discuss how you designed your memory care unit, how you put it on the second floor, how you made it accessible to the 20 people that are in there, and that's another remarkable thing, because my background, I've with the Alzheimer's Foundation, I know a lot about memory care, but what you've done there is innovative. It's different.
Absolutely. So I would say the couple things that really differentiate us is technology first. We've incorporated the passive health monitoring technology, which it's really amazing to see as it learns. So over this past year, we've really started to see some huge benefits from the passive health monitoring. And that's specific technology that's actually in the resident rooms. It learns the resident in their body shape, and then it tracks their health behavior. So we really are starting to see some tremendous benefits from that. And as I tell everybody, it's going from reactive healthcare, which is what everybody does right now, to proactive. So it really helps us identify potential concerns with residents before the typical healthcare professional will even be able to pick up on those things. So that I think is absolutely a differentiator. Our dining experience, it's a true restaurant-style experience. The typical experience is you have a couple entrees to choose from, maybe a couple alternates, where with Zon, I wanted a true restaurant-style experience. Our residents sit down, open dining times. We have a full menu of probably 40-plus different entrees and a fresh catch of the day. And so it really is a much more enjoyable experience, in my opinion, for the residents. And then kind of touching on that memory care, is it's an open concept. And so there's no hallways, which is great for not only the residents, but also the staff members, because the residents don't have to navigate hallways. And so you don't see the residents getting stuck at the end of hallways like you may see in some facilities. We take for granted that it's very easy for us to walk down a hallway and turn around. And for an Alzheimer resident, that's much more difficult to get to the end of a hallway, and just turning around isn't as simple as you or I think it is. So the open concept, the residents come out of their apartments and they're right into the living space. It makes it very easy for them to be able to navigate their living space. And then even more so for our staff, they can see all of our residents without having to walk down hallways and find the residents. So they can turn and actually see our residents very easily. So it's another great safety factor and responsive factor.
The question I have is that, let's say, can you actually, how do you know somebody has fallen in a room? Do you have somebody on a sensitive station or someplace that can see that?
So we have the kind of the typical staff, but we also, that passive health monitoring actually picks up on falls. So once it learns that resident, it sends us an alert immediately when someone falls.
But where does the alert go? Who's watching this all the time?
It sends it to like a cell phone device that our staff carry. So they actually get an immediate alert, which is a big concern for any family, is at any healthcare facility across the country, is if someone falls and their door's closed, unfortunately, it may be some time.
I know, that's why I asked.
And so this device actually picks up on that fall, and we get an immediate alert. And not only the alert, but we also get a video of that fall. It's infrared, so it's not like a typical video camera. It's not intrusive, but we can make out their body shape. So not only can we respond, but the nurse can be at the bedside, review that video, and actually see, did they maybe hit their head? Did something happen that we need to send them out to the hospital for? Just to give you a great example, this morning we picked up on a fall that a resident fell out of bed, was sleeping, fell out of bed, and got themselves back into bed. In a typical facility, you would not even know that ever happened. We were able to get in there, assess him, make sure all of his extremities were okay.
So what you all did then was went in and checked.
Correct. We got the video and saw that he rolled out of bed and got in there and did an assessment just to make sure he was okay.
Okay, but Betty, we're going to take a break. But I'll keep on until I hear the music, John. In your business, you go out and you help people do this, but a lot of the people you can wear the medical alert system. And what that medical alert system does, they still have to press a button. But I got a signal. We got to take our mid-show break. Well, I'll pick back up with Betty and the medical alert when we come back. So don't let me forget that, Betty.
Okay.
All right, Carol. I said Betty.
That's okay.
You're taller than Betty is.
Yeah.
Okay. All right. Stay with us, folks. We'll be back soon.
WMEL. That's the sound of the 1951 Ford Victoria Hot Rod, fully restored and donated from the private collection of A.J. Hires. It's the 2017 Win the Classic Ford car raffle to support Helping Seniors of Brevard. You have to see this car. I'm Kerry Fink, and I'm inviting you to visit helpingseniors.brevard.org for full information on this exciting car raffle. That's helpingseniors.brevard.org. Stay tuned for more info on the Talk to Me radio network. We're glad that WMEL cares about the space and Treasure Coast.
This is Joe Steckler, folks, back live with the second part of Helping Seniors, the radio arm of helpingseniors.brevard.org. My panelists today are Carol Knouse of Avid Home Care and Greg Kennedy, who is the director over at Zon Beachside Assisted Living facility. I think we've had a really, really good discussion about both organizations on the first part of the show. And we're talking a little bit about differences. Oh, I was mentioning some of my sponsors for the show, for the second part of the show. I'd like to mention Senior Scene Magazine. It's a magazine that reaches out to about 40,000 people that are read it here in Brevard County that it features our sponsors. Greg has a column in there sometimes, and Carol will have a column in there. But it talks about how people can get help, and reaches out to a lot of people. And I have a column in there, and I have a column in Hometown News, which reaches 129,000 people weekly. And we have a couple of columns in there every month. But I talk about how our sponsors and the community work together, and how we can just start do a better job of working together and helping organizations. But it's organizations like Hometown News, Senior Scene Magazine, Courtney Braswell Financial Group, Barbara McIntyre, who is a home equity loan specialist, and Canadian Meds of Melbourne, which provide prescription drugs through Canada. And believe me, folks, if you're having trouble purchasing prescription drugs, or affording them, give Canadian Meds a call. In order, if you don't know all the phone numbers, call Kay Kaiser, who is our information specialist at 321-473-7770, and Kay will put you in touch with all these people that can help you. And it's ridiculous to deny yourself medications when it's completely possible to get these things. And barring a fact that you might not be able to pay for the things, there are ways to get them free too. Not all medications, but some of these medications are free if you just know where to go. So don't think you can't get the right kind of help. You just have to go to somebody that can help you get pointed in the right direction. That's one of the jobs of helping seniors. Before we took the break, we just started talking to Carol about Greg has outlined for you and sort of discussed how when they developed Zon, how they did things a little bit differently there, and they've been very successful. Carol was just starting to describe how Avid Home Care is. You go ahead and pick it up, Carol.
Sure, Joe. Yeah, it was interesting when I was listening to Greg talk about, the thought process that went into the way that he wanted Zon to operate and to care for their residents. Betty and I did the same thing at Avid. We looked at a lot of options for the agency when we opened it, and we decided that what was really important to us was the care process, and we wanted to make sure that we could customize our services to our clients and not the reverse. In other words, we didn't want our clients to have to fit into some mold that we came up with. We want to be able to customize services for clients. And it's important to us, I think. So many people, I believe, as they age, they start to think about the things that they can no longer do. And what we try to do is focus them on thinking about the things they can still do and not what they can't do any longer. And we want to help them with those things that become burdensome.
You could be a good pair of crutches for me, and I wouldn't hurt myself when I walk around. I'm only kidding, but I'm serious. But Carol's got something that's really key to aging with dignity, folks. As we get older, I don't want to fit into some other mold that somebody designed for me. I want to be myself.
Right.
And I want to be able to open my mouth and speak when I want to. And I say that because there was a lady named Marcia Reynolds that had something in the paper she said today. And folks, it's something I've been talking about for 15 years. And it has to do with the way that Brevard County Board of County Commissioners treats nonprofit organizations and the way they allocate money. Seniors are the second largest supporter of the county budget. Yet, you take a look at the programs that the county goes back and helps seniors with, it's almost zilch. Mm-hmm. And this Marcia Reynolds had it right on the nose. She said that the commissioners ought to be ashamed of themselves because they denied money to Aging Matters, which operates the Meals on Wheels program, and instead they gave money to a charter school, not only in the CBO funding process. See, the lady didn't know this, but they also gave them almost an equal amount of money through the Community Development Block Grant Program, which is designed to help needy, and not people that are affluent enough to go to a charter school. Mm-hmm. And Marcia had a good point. She said, why in the world are we funding a school, a charter school, it's a private school, when in fact they elect to go to the charter school of their own volition? If they went to a county school, They have bus services already provided. There's just a lot that we don't know about, and that's what makes it so. I get excited and I get it's not upset's not the right word, but I get really concerned when I have two guests like you, Greg, and you, Carol, that know what you're talking about with regard to care. And I think that a lot of people don't know when they should be thinking about looking at assisted living and looking at a type of service you all provide, Carol. But Greg, talk for a little bit about how do people really know when it's time to start looking for assisted living?
I think I always tell families the key to all of it is plan ahead, plan far in advance. We don't buy a house overnight, and you sure don't want to pick an assisted living overnight. And so I encourage families, plan even years in advance, because all you're going to do is educate yourself. You're going to understand the options that are out there, and they're not all the same. And so you want to make a decision now about what your future might hold. You may never have to make that decision, but at least you've made a proper decision. And I think the key is to understand the full spectrum, from home care to assisted living to a nursing home, and understand how they work together, what can each provide, and how do they flow between, because we work a lot daily with home care, because it's a seamless process. It's not just home care in the community and assisted living and nursing home. We work a lot with home care within the facility because it's a great transition for the resident. And so understanding what can I do in their home to keep them there as long as possible, which I think is very important. And I think the more you plan ahead, I think you don't speed up the process to go to an assisted living and nursing home. You educate yourself more so they can actually remain in their home longer by bringing in someone like Carol, and then understanding. And I tell families, my kind of statement to them all is, you'll know the day when an assisted living is right. There's factors, whether it's a safety factor, maybe a wandering, the house is getting to be just too much, socialization. But you'll know that day as long as you plan ahead. And then, having someone like a home care agency on board helps ease that transition. And that's, I think, key is it's pretty seamless because you have someone that knows the resident and they move right with them into the assisted living, and you keep that knowledge base. Then my staff gets to know and learn the resident because you've brought that knowledge with the resident, as opposed to kind of breaking that cycle.
Well, you hear the old phrase, knowledge is power, and you want to empower yourself. And sometimes people use that and they say, what the hell does that really mean? What it really means is that you get smart so that you figure out how you can afford to do what needs to be done in the future.
That's right.
Absolutely. And I think people get scared because they start talking about the money. And if you educate yourself, you can at least plan ahead so you understand what those costs are. And there's a wide spectrum of costs out there. And so understanding who does what, and what does home care cost, what does an assisted living cost, and if I have to merge those together. And education, like you said, is power. So
yeah. Carol, from a business person viewpoint, what would you add to what Greg is talking about?
Well, I think one of the things that I think as people look toward moving perhaps from their home into assisted living, and if they've had a home care agency like ours where they get used to a particular aid that's helping them, what Greg talked about, where that aid, we as Avid, for instance, if we're working with Zon, we can continue to help that person that moves into assisted living, because they may need additional services that either Zon cannot provide, or they just want that familiar feeling of that aid that's been helping them. So we work together seamlessly in that area, and I think it's important for people to understand that it's not one or the other. We can work together and make it a much easier transition for someone.
This is a point that we seldom talk about on our shows, but it was something I became very, very familiar with when I was the director of the Alzheimer's program. I realized the importance of the continuity of care. Mm-hmm. And, when you're caring for a person with dementia, you just don't turn care off and on. You have to have an element of continuity there, knowledge, familiarity. If you just don't take a person that has dementia and subject them to new surroundings
That's right.
without a great deal of thought.
Absolutely. We also, in terms of, assigning a particular person to care for a dementia client or an Alzheimer's client, we try to make sure that we have that person consistently for them. Now, obviously, there are times when someone is sick or, something comes up and that particular aide cannot care for them. So in that case, the way that we set our services up is that we assign a primary caregiver that will take care of that client, and then we have a backup or a secondary person that would fill in the event that somebody could not be there. But, that consistency of service, especially for dementia or Alzheimer's clients, is absolutely critical. They get scared. They get scared when a stranger, comes to their home.
Right. Understand.
And, seeing a familiar face is something that's very important.
Okay. Greg, you've been a director now for over a year at Zon, almost 2 years,
Going on 2 years.
going on 2 years. In working with families, what have been some of the financial challenges you've had to meet with terms of you talked about advanced planning. We think about terms of long-term health care insurance, talk about Medicaid, thinking about other types of insurance, annuities, and just how people pay for this type of care. What have been some of the things that you could tell our listeners to be looking for or planning for?
Well, I think, the one thing I always stress to every family is, the benefit that's out there for so many people, and probably 99% of people don't know what it is, which is aid and attendance. And that's most people that walk through our door have never heard of it before.
What is aid and attendance?
So it's a benefit for veterans, and there's some requirements, and so I always recommend you can obviously go through the process yourself, but it can be a difficult process. There's resources out there also to help you. But if your loved one ever served in the military, most of our veterans today probably meet the requirements. They served during a time of war at some point, most likely. They probably are eligible, at least at the top level, and then there's some eligibility requirements financially, but it is probably the greatest benefit out there, even if you don't need it today. If you're in so many families say, well, my mother only has so many dollars saved, I'm scared of running out of money. Look into aid and attendance today, even though you may not qualify, because you may need it in a year or 2 years from now. And again, educate yourself to the process, start the process early, and so it's seamless, hopefully. That's probably the top of my list, is always aid and attendance, because so many people are eligible for it and so many people fail to tap into that resource. Beyond that, I think it's understanding, people look at the cost of home care, assisted living, and say, oh my gosh, it's so much. But you also have to consider the fact that on the assisted living side, you are paying to maintain a home and possibly a car, transportation, food, electrical, and all of that. And so you have to consider all of the costs that you're currently spending today, and then what is that difference to add in the benefit of having someone there 24/7, having someone there to prepare consistent, nutritious meals, having the socialization factor. And so sometimes it's breaking that down for families and having that conversation again. Again, it's much easier to have that conversation today, planning in the future, so you understand, the difference is so many dollars, and I can plan ahead for that difference.
Do you find many people have long-term care insurance?
Some do. It's not as prevalent, probably. Many of the companies backed out of it years ago, so
I know.
it's probably not as prevalent as it used to be. And then, some people have grandfathered policies, which are great. Some of the newer policies, again, a great benefit if they have it. Probably not as many people have it as they used to. But we find the policies generally pretty easy to work with.
Yeah.
And
Well, outside of marrying my wife, the second smartest thing I did was to see. There, I do say the right thing sometimes. One of the second smartest things I did was both of us did, and but I'd like to think I took the lead in encouraging us into doing the long-term care insurance. We both have it, and hers is much less costly than mine. Tara's a little bit younger than I am, and she does not have the medical problems that I do. But I was very, very fortunate because we have a policy with Kanawha and Mutual of Omaha, and they have the cost of living increases in them, and it will not pay the entire cost.
Right.
But my goodness, without that policy, the cost could be really, really bad. But
and so many people don't understand what their policy even covers. I mean, most of the time, and we're happy to do this, people bring in our policy to
I'm
us.
glad you're talking. Let's talk about that because that is so important.
We do the same thing.
You do the same thing?
They don't understand, and they don't understand what triggers payments from that policy and what they have to be eligible for, which is typically, they talk about the activities, the 6 major categories of activities of daily living, and most of the long-term...
What do you mean by activities of daily living? You're never going to talk about this enough.
The activities of daily living are things like bathing, eating, toileting, grooming, all of those kinds
Feeding
of...
yourself.
Yes, yourself, that's correct.
It all has to do with you.
That's right. And the long-term care policies usually lay out all of those activities, and you typically have to have some sort of hospital stay or have had some kind of skilled services for a period of time and not be able to perform at least 2 of those activities of daily living. Those are the policies that we've seen. I don't know about you, Greg. Is that typically what you
exactly.
see? Yeah,
Very similar. And I think so many times the families are concerned about what I call the IADLs,
right.
the independent activities of daily living, shopping, all of those type of things. And that's where I think home care comes in, where they're not ready for me yet because they can do a lot of their activities of daily living still within their own home, and still very appropriate to be in their home, but they need some support services. And so again, understanding, home care can provide some IADL assistance, and then when that day comes where the activities of daily living become too much, maybe that's a transition time.
Now let's talk about the really scary thing about that we don't talk about on our television or radio shows, or I don't really write about in my newspaper columns, and nobody else mentions it because it's that part of senior living, aging, that is scary to people and they don't want to talk about it. And I'm talking about the people that no matter how much we talk about this, no matter how much we say about it, there are simply people that cannot afford even your care, Carol, and they certainly can't afford your care, Greg. And we force them simply because we haven't figured out a way yet to take care or assist these people so they can get a decent way to live their senior living life with a little dignity. We haven't figured out how to do this yet, so we force these people into a nursing home at a greater cost to the government, at a cost that the families can't even begin to pay, or the person that needs that care can't even begin to pay, because we're talking now across the United States, we're finding the average cost of good nursing homes are reaching in the upper $80,000 per year. And how in the world can a person that if they've averaged making $40,000 a year over their entire life, their working years, how in the world do you, and they had a family, how in the world do you expect them to save when the average cost of a 4-person family policy for insurance is now $14,000 per year? How do we do these things?
Well, in
Carol?
the home care area, there is and I'm not sure if this applies to assisted living too, Greg, because I'm sure you can comment on that, but there is a Medicaid managed care program, long-term care, that is exactly for those that qualify for Medicaid. That long-term care program will pay for home care, and it's specifically designed to keep people out of the hospital or nursing homes in facilities because it is much cheaper to keep them in their own home, assuming they can stay in their own home safely. So I know that Medicaid does cover our services in those areas. I'm not sure about assisted living.
It does. It does. Some of yours too does.
There is, yep. There's the Medicaid waiver program that
Right.
will cover.
Yep. But here's the real catch there, folks. Right now, there are at least 60,000 people in the state of Florida that are on the waiting list for that type of care, Carol. Are you aware of that? Did you know that?
I did not know that it was to that extent.
That's how big the list is.
Yeah. Wow.
It is. Unless they may have gotten a few thousand off the list, but I can assure you there's over 50,000.
And it's only going to continue to grow.
Yeah,
And it
sure
continues
is.
to grow, and as we add more people to it, we're going to compound the problem.
Yep.
And the other part of that equation is that when people go on a waiting list, they can be bumped down on a waiting list by people that have a greater need. So you get people that may need help with 3 activities of daily living. When you talk about eating, housing, and maybe getting themselves ready to go out in the world on a daily basis, and they're superseded. How are they ever going to live? That's the problem. Greg, what was your life? We got a minute left. What would you want to say in your last 25 or 30 seconds?
Well, again, I think the focus of this show, I think, has been great, which is educate yourself and plan ahead. And so if I can leave the audience with nothing more than that, is just, please don't be scared of senior care. Actually, just educate yourself, and it's not as scary as you may think.
And you got to ask a question. That's why you need to call Kay at 473-7770. She'll get you pointed in the right direction. And next time we'll let you say more, Carol.
All right.
All right.
Thanks,
We're out of
Joe.
time. Thank you for listening, and be here with us next week. And don't forget the car raffle, folks. We need your help.